Breathing is honestly just fundamental to life. Every single cell needs oxygen to function properly. But, when airways get blocked by mucus, this vital process is really compromised. That can lead to some pretty serious health problems. Cystic fibrosis, bronchiectasis, COPD often have to deal with excess mucus production. This mucus can trap bacteria, which leads to frequent infections. It can also block airflow, causing shortness of breath and reduced lung function. For these individuals, even the simple act of breathing becomes a daily challenge, affecting energy, mobility, overall quality of life. Effective airway clearance isn't just another treatment. It's honestly a lifeline. As physical therapists, our role goes way beyond just muscles and joints. We're actually essential in managing respiratory health. Our expertise in functional movement and physiology really puts us in a great position to help patients clear their airways effectively. By teaching specific techniques, we empower proactive self-management. Postural drainage is, honestly, a fundamental technique that uses gravity to help drain mucus from specific segments of the lungs. The lungs are divided into lobes. Each lobe is further divided into smaller segments. Each segment has a bronchus, like a small pipe pointing in a direction. Position the patient so the targeted bronchus points downward. Gravity pulls mucus to larger central airways where it can be coughed out. This is passive, but very effective when done correctly and consistently. First, identify congested segments by auscultation or by reviewing a chest X-ray. Then place the patient in a specific position to drain that segment. To drain the lower lobes, head down, hips elevated. Upper lobes, sit upright and lean forward or lean backward. Hold each position for about 3 to 15 minutes. Ensure comfort and safety with pillows, wedges, or an adjustable bed. Monitor for distress. Increase shortness of breath, dizziness, changes in heart rate. Some positions are unsafe with uncontrolled hypertension, recent surgery, or GERD. Perform a thorough assessment, teach home practice, and provide clear step-by-step diagrams. Coach family or caregivers. Set frequency and duration per condition, promoting independence and fewer routine visits. Chest physiotherapy, or CPT, is often called percussion vibration. It's an active manual technique used to loosen and mobilize mucus, often paired with postural drainage. Percussion involves rhythmically clapping over the congested lung segment with a cupped hand. This creates a pressure wave, helping dislodge thick, sticky secretions. Cupped, not flat, to trap a cushion of air for effectiveness and comfort. Never over bare skin. Use a thin towel or clothing. Avoid the spine, sternum, stomach, and recent surgery or injury. Use relaxed wrists. Drive from elbow, wrist, to create a gentle hollow pop. Vibration follows percussion during exhalation. Place a flat hand firmly. Tense the arm to create a fine shake as the patient exhales slowly. This helps move loosened mucus toward larger airways. Use clinical judgment. Modify for frailty, osteoporosis, bleeding risk, or use mechanical alternatives. In addition to manual techniques, a variety of airway clearance devices can assist. Flutter, Acapella, HFCWO vest. PEP devices help patients exhale against resistance to create positive pressure and prevent airway collapse. Back pressure lets air get behind mucus and push it centrally. Many add oscillation, oscillating PEP, to shake mucus loose. Acapella and Flutter oscillate as the patient exhales, enhancing clearance. Technique: inhale a bit deeper. Exhale actively but not forcefully for several seconds. Repeat 10 to 20 breaths. HFCWO vests use rapid air pulses to create gentle, high-frequency chest vibrations. Sessions last 20 to 30 minutes and clear all segments simultaneously. Therapists should know when to recommend devices based on diagnosis, physical and cognitive ability, and preference. Provide instruction on assembly, use, and cleaning. Then teach huffing and effective cough to clear mobilized secretions. Diaphragmatic, or belly breathing, is the most efficient pattern of breathing. It uses the diaphragm, the dome-shaped muscle under the lungs. On inhale, it contracts downward to create space. This allows fuller expansion with less effort than shallow chest breathing. For COPD and other conditions, engaging the diaphragm is crucial. Strengthens the primary muscle, reduces work, and improves gas exchange. Start supine with knees bent and supported. Relax accessory muscles. Place one hand on the chest, one on the abdomen for feedback. Goal: abdomen rises on inhale, falls on exhale. Chest remains quiet. Inhale slowly through the nose. Gentle, not forced. Then exhale slowly, letting the abdomen fall. Use gentle cues or light pressure on exhale to reinforce the pattern. Progress from lying to sitting, standing, and walking until it becomes automatic. Practice 5 to 10 minutes several times a day. Over time, reduced respiratory rate, lower oxygen demand, less breathlessness. It becomes a powerful self-management tool. The goal is natural, effortless diaphragmatic breathing during daily life. Pursed lip breathing is a simple yet powerful technique to gain control, especially during shortness of breath, common in COPD. It slows exhalation and creates gentle back pressure, like PEP, to keep small airways open longer. More trapped air escapes, reducing hyperinflation and easing the next inhale. First, relax the neck and shoulders. Breathe in slowly through the nose for a count of 2. Purse the lips as if to whistle or gently blow out a candle. Exhale slowly and steadily for a count of 4, about twice as long as the inhale. The exhale should be passive and relaxed, not forceful. Practicing in a mirror helps reinforce correct form and rhythm. Use it during breathless activities, stairs, groceries, walking, to go longer with less difficulty. It's portable, needs no equipment, and can be used anywhere. With regular practice, it becomes second nature, restoring calm and control. Effectively integrating airway clearance and breathing techniques requires a patient-centered approach. Every plan must be tailored to the diagnosis, functional limitations, and personal goals. Begin with a thorough assessment. Auscultate, evaluate breathing patterns, measure oxygen saturation and respiratory rate at rest and with activity. Use this baseline to choose manual CPT, a device, or postural drainage. Then educate. Explain how and why using simple language, models, and clear handouts. Structure sessions. Begin with breathing control. Like diaphragmatic breathing, proceed with airway clearance, such as postural drainage with percussion, and conclude with huffing and cough to clear secretions. Schedule morning and evening sessions. If using a bronchodilator, perform clearance about 15 to 20 minutes after dosing. Fit the routine into daily life for consistency. Reassess regularly. Are they clearing more sputum? Is breathlessness improving? Are they able to do more? Adjust positions or introduce oscillating PEP to promote independence. Combine skilled hands-on care, thoughtful education, and ongoing assessment. Physical therapists can unlock better breathing and quality of life, the hallmark of excellent cardiopulmonary